estimated 12 million of us here in America suffer from a condition called carpal tunnel syndrome. It causes pain and numbness, even tingling and weakness in the hand and in the wrist. In today's HealthCast, though, we're taking a closer look at a procedure that can correct the problem without invasive surgery. The simple act of typing used to be really painful for Amy Wendt.
I started to notice that at night my hand would go numb, mostly my right hand, predominantly my right hand. It would go numb and it'd be tingling, and I thought maybe I was sleeping in a funny position.
But within a year, the pain spread to her left hand and the sensation got worse.
It was as if someone was sticking a knife in and then with an electric charge on it.
Dr. Jorge Gonzalez, a sports medicine specialist with Broward Health's Imperial Point Medical Center, says Amy had the classic symptoms of carpal tunnel syndrome.
What happens in carpal tunnel is that one of the nerves, particularly the medium nerve, gets compressed. When the nerve is compressed, it starts to suffer, leading to pain, numbness, tingling, and if left untreated, permanent nerve damage and long-term weakness.
The first-line treatment is non-surgical: medication, night splints, activity modification, and steroid injections. Once severe damage is done, the only option is surgery.
The problem with surgery is that traditionally the recovery tends to be quite long, weeks to months, and a lot of patients do not want to pursue the surgical option due to the prolonged recovery.
A newer option is a technique called Sonex, done under just local anesthesia, using ultrasound-guided technology to correct the problem.
It allows me to see inside the wrist, being able to identify that band of tissue that puts pressure into the nerve, and with newer technology, I could make a 3 to 4 millimeter incision that allows me to access the wrist and free up the nerve.
A few weeks after surgery, Amy was back in action, enjoying her favorite activities again without any pain.
It was completely gone. It was fixed.
Isn't that amazing? So the procedure takes only about 15 minutes and can reduce the patient's downtime from 5 weeks to just 5 days.